Place the package of correctly sized gloves on the flat surface. Peel open the outside wrapper, exposing the sterile glove package. Position the package so that the designation of right R and left L is visible right side up if this is indicated on the package. Using sterile technique, open the glove package handling only the outer wrapper. Glove dominant hand first by grasping the edge of the cuff with the thumb and first 2 fingers of the non-dominant hand, touching only the inside of the glove. Carefully pull glove over dominant hand, leaving cuff and being sure cuff does not roll up on wrist. Work thumb and fingers into correct spaces. With gloved dominant hand, slip fingers underneath cuff of second glove and pull glove over fingers of non-dominant hand. Take non-dominant hand and pull under cuff and pull down dominant hand cuff on wrist. Interlock fingers of gloved hand and hold away from body above waist level. Sterile technique is maintained throughout the procedure. Wash hands and apply clean gloves.
My hands are washed.
Identify patient and verify doctor's orders.
Ms. Barker, I'm going to verify your medical record number and your name. We'll be removing your Foley catheter today. Okay.
Assist patient into a comfortable position. At this point, you would empty the urine collection bag and measure the output. This has already been done. Attach the syringe to the port and remove saline, then remove Foley catheter in one smooth movement.
One, two, three.
Dispose of equipment and assist patient into a comfortable position.
Okay.
Verify patient safety precautions, bed locked and in low position, side rails up, and the call bell in reach. Remove gloves, wash hands, and make sure you document procedure and record urine output on your I&O record. Wash hands. Identify patient and verify order.
Okay, we have a Foley catheter insertion order. I'm going to identify my patient with 2 patient identifiers, and we have the correct patient.
Assist patient into dorsal recumbent position. Open sterile kit on bed between patient's legs.
Away, side, side, and back.
Apply sterile gloves. Drape the perineum. Lubricate the Foley insertion catheter. Go ahead and open up your swab sticks, making sure that the patient is not allergic to iodine.
Ms. Barker, are you allergic to iodine? She says no.
You will lose sterility of your non-dominant hand by placing your non-dominant hand on the patient's perineum. With a female, you will clean side, side, middle. With a male, you will clean using a circular motion starting at the urethra and rotating out. Use a different swab for each side of the labia and down the urethra. Do not remove your hand once you've cleaned the side. Insert the catheter 3 inches for a female and 7 inches for a male, or until urine is seen in the tubing. Ensure sterile hand holding catheter does not touch perineum. Urine is now seen in the bag. Inflate the balloon and detach the syringe. Remove sterile gloves and apply clean gloves. Secure tubing to leg with tape. Secure collection bag to the bed frame and not the side rails. Dispose of equipment and assist patient to comfortable position. Verify patient safety precautions, bed locked and in low position, side rails up, call bell in reach, and wash hands. Document procedure and urine characteristics and make sure sterile technique is maintained throughout procedure. Wash hands. Identify patient using 2 patient identifiers and verify your doctor's orders.
Okay. Mr. Barker, I'm going to do some suctioning of your trach. I'm going to verify your medical record number, your name. Okay. With 2 patient identifiers. Okay.
Position the client in at least semi-Fowlers and turn up the oxygen to hyperoxygenate him. Note the patient has on a trach collar who he will be receiving oxygen. Turn on the suction device. And test your suction. Go ahead and remove the trach collar. Prepare sterile suction catheter kit and apply your sterile gloves. Once your sterile gloves are on, prepare your kit, pouring the sterile normal saline into the suction cup. Connect sterile suction catheter to suction tubing and test your suction pressure. You will lose sterility with your non-dominant hand. Test the tubing into the sterile water to make sure that the suction is working. Insert catheter into trachea and only apply suction as catheter is being removed for no longer than 10 seconds. Dispose of equipment and remove gloves. Turn off suction device. Wash hands, document procedure, and make sure sterility is maintained throughout the procedure. Tracheostomy care. Wash your hands. Identify the patient using 2 patient identifiers and verify the doctor's orders.
My 2 patient identifiers, this is Mr. Barker, and we're going to do trach care.
Apply clean gloves and remove the soiled tracheostomy dressing. Remove the gloves and wash your hands. Position the client into semi-Fowlers and go ahead and hyperoxygenate by turning up the oxygen. Remove lids on hydrogen peroxide and normal saline and place lids upside down. Open sterile trach kit. Open your sterile gloves and apply 1 sterile glove, and remove contents of sterile tray, placing them on your sterile field. You may use the same packaging that your sterile gloves are packaged in. With your non-dominant hand, prepare your sterile trach care kit, making a cleaning solution of hydrogen peroxide and normal saline mix, and then 1 rinsing solution of normal saline. Apply the second sterile glove. You may go ahead and place the items that you will need to clean around the trach into the solutions. Putting the scrub brush and the hydrogen peroxide and normal saline mix, and the others in the normal saline. Make sure that you leave several dry gauzes out to clean around the trach. Remove the inner cannula and place into the hydrogen peroxide normal saline mix basin. You will lose sterility with your non-dominant hand. Once it's in the hydrogen peroxide and normal saline mix, cleanse the cannula with the small brush. You may lose sterility at this point, but the point is to be as clean as possible. So you're using as clean technique as you can. Rinse cannula with normal saline, dry, and replace inner cannula with secure locking mechanism. It should lock in place. Now cleanse the stoma site with the hydrogen peroxide normal saline mix. Make sure to remove any dried secretions. Rinse the stoma with normal saline. Dry if necessary. Place sterile trach dressing under the ties and the face plate. We will not be removing the trach ties as that takes a two-team method approach. After this, dispose of your equipment, remove the gloves, and wash your hands. Dispose of equipment, remove gloves, wash hands, assist patient into a comfortable position, verify patient safety precautions, wash your hands, document your procedure, and you maintain sterility throughout the procedure. Insertion of NG tube. Wash hands and apply clean gloves. Identify your patient using 2 patient identifiers and verify the doctor's orders.
I have an order for an NG tube insertion, and this is Mr. Bob Barker, and we verified using two patient identifiers.
Position the client in the high Fowler's position and prepare your equipment. Check nasal patency to select the side with best airflow using your pen light. Make sure there's no septal deviations or polyps present. If there is, use the other nose. Measure tube from tip of nose, behind the ear, to the xiphoid process and mark the tubing with tape. Curve the tube around the hand to loosen, and then you may lubricate the tip of the tube with a water-soluble lubricant. You may have to get one if it does not come in your kit. Have the client lay their head back for initial insertion. Then move the chin to the chest, asking the patient to swallow as the tube passes into the oropharynx. Verify the tube is not coiled and in the back of the throat. Advance until the tube marking is reached. For the purpose of this video, this mannequin's NG tube will not go down all the way, but you will insert until you get to your marked place. Secure the tubing with tape. Verify placement by asking the client to speak.
Would you speak for me, please?
Inserting 30 milliliters of air with auscultation of the stomach upon insertion of air. You should hear a swooshing sound over the abdomen when the air is inserted. After you've inserted the air, aspirate 10 milliliters of gastric content and measure the pH, which should be less than 4 on the pH scale. Confirm placement ultimately by X-ray examination prior to insealing fluids into the NG tube. Dispose of equipment and assist patient into a comfortable position. Verify patient safety precautions, bed locked and in low position, side rails up, and the call bell is in reach. Wash hands and document procedure. Removal of NG tube. Wash hands and apply clean gloves. Identify the patient using 2 patient identifiers and verify the doctor's order to remove the NG tube.
Okay, I have a doctor's order to remove the NG tube. I'm going to verify my patient using the 2 patient identifiers. And this is Mr. Barker, and he is getting his NG tube removed.
Assist the patient into a comfortable position. Remove tape from the nose and in one smooth movement, pull tube out while coiling the tube in your hand.
Okay, I'm going to pull the NG tube out.
Dispose of equipment and assist patient into a comfortable position. Verify patient safety precautions, wash hands, and document your procedure. After putting on clean gloves, go ahead and open up the central line dressing tray. Wave, side, side, and back. Place mask on patient unless contraindicated. Otherwise, get the patient to turn his head opposite the side of the PICC line. The nurse will also need to wear a mask. Gently remove old tegaderm dressing without touching insertion site with clean gloves. If the PICC line has a stabilization device, make sure that you hold the catheter in your non-dominant hand towards the end while you remove the stabilization device. Inspect the catheter site for signs and symptoms of infection, phlebitis, and bleeding. Make sure you measure the external catheter length and the arm circumference per facility policy. Compare this with your measurements in the chart. Inspect the surrounding skin for edema, breakdown, and irritation. Remove your gloves and perform hand hygiene. Don sterile gloves from the central line kit and arrange your sterile supplies. Clean site with chlorhexidine scrub or iodine, whichever comes in your kit. Make sure to scrub for at least 30 seconds and clean from inner to outer, from clean to dirty.
Can you please hand me my bio patch? Sterilely. Thank you.
So make sure you scrub the site with chlorhexidine scrub for at least 30 seconds, cleaning from inner to outer and allowing to dry thoroughly. You may apply the skin protectant. Place the chlorhexidine impregnated patch or the biopatch over the catheter per facility protocol. The blue side should be facing up. Apply a new securement device if needed. Place the holes of the catheter wings over the post and close doors of plastic cradle one side at a time. Apply transparent dressing over the PICC site. Remove your gloves and mask and the mask from the patient as well. Perform hand hygiene and label the dressing with your initials, date, and time of dressing change. Document the procedure and any measurements taken and the patient's response. Wash hands and apply clean gloves. You will identify your patient using two patient identifiers and verify your order. For the purpose of this skill today, it will be done on a wound care model. Remove the sole dressing, pulling tape towards the suture line, and dispose of in the trash or on a dirty area. As you remove the sole dressing, make sure to assess the wound, noting location, type, size, color, odor, drainage, and condition of the staples or sutures. Remove gloves and wash hands. Prepare sterile equipment needed for dressing change. Go ahead and take the lid off of the normal saline bottle. Open up your sterile 4x4s. One package will be wet with the normal saline solution, and the other package will be dry. Apply sterile gloves. Cleanse the suture line from top to bottom with one of the wet 4x4s with the normal saline solution. Cleanse the skin along each side of the incision using a single gauze for each stroke with normal saline solution. Dry suture line from top to bottom with dry gauze. Dry the skin along each side of the incision using a single gauze for each stroke with dry gauze. Apply dry, sterile dressing and secure with tape. The pad will be taped down. Remove the gloves and apply the label with date, time, and initials of the person changing the dressing. Dispose of equipment and assist patient to comfortable position. Verify patient safety precautions. Wash your hands. Document your procedure on your wound document sheet and make sure that sterility is maintained throughout the procedure. Okay, leave it in isolation room, and this must all be done in the correct sequence. Remove gloves first. Remove goggles. Unties waist and neck strings of gown. Remove hand from sleeves without touching the outside of the gown, and remove the gown folding inside out. Removes mask by only touching the string. Alright, verify patient and verify order for Benadryl to be given IM.
Okay, this is Mr. Bob Barker. He is not allergic to anything, and I have adequately identified my patient with 2 patient identifiers.
Determine the correct site for injection, verifying that the medication is not given in an arm with a dialysis shunt or on the side of a mastectomy.
Okay, and it's not.
Landmarks are identified, verifying correct location for insertion, and today we are using the deltoid muscle. The skin is cleansed with alcohol. While the site is drying, the medication will be pulled up. The skin is pulled taut and the needle is inserted at a 90-degree angle. The medication is injected. The needle is removed with the safety device utilized. Gentle pressure is applied to the injection site, and a Band-Aid may be applied as well. The needle syringe unit is placed in the sharp box, and documentation is provided on the MAR. Next, we're going to be given a subcutaneous injection. A subcutaneous injection may be administered in the back of the arm or in the abdomen. And if it is used in the arm, make sure that it is not used on the same arm with a dialysis shunt or on the side of a mastectomy.
Okay.
Your landmarks are identified, verifying the correct location for insertion, no closer than 2 finger widths next to the umbilicus. The skin is cleansed with alcohol. Medication is pulled up. The skin is slightly pinched, and the needle may be inserted at 45 to 90 degrees depending on the size of the patient. The medication is injected. The needle is removed with this safety device utilized. The needle syringe unit is placed in the sharps box. Gentle pressure is applied. A Band-Aid may also be used. Make sure you document your medication administration on the MAR. Lastly is an intradermal injection, which is given in the forearm of your patient. Make sure that it is not injected on the same side of a dialysis shunt or a mastectomy. Your landmarks are identified. The skin is cleansed with alcohol. Pull up your PPD solution. The skin is pulled taut. The needle is inserted bevel up at a 15-degree angle until the bevel is underneath the skin. The medication is injected and a wheel forms. The needle is removed with the safety device utilized and placed in a sharps box. Make sure to document the medication administration on the MAR.